Good evening, everyone, and welcome to our IVF webinar. It's a Monday evening, and I'm glad to be back here. With all of you after the weekend. And I do hope you have lots of energy and also are ready to learn a few things, but also ask your own questions. I'm Caroline, your host, and I hope you can hear me loud and clear. So just let me know. And we do have a very interesting and another topic on male fertility. So I'm very proud to introduce to you Birol Aydin. He's the embryologist at IVMED, and also he's the head of the Embryology Lab at IVMED, which is located in Kiev, in Ukraine. So hello, Birol. How are you feeling tonight? Hope you are good.
Hello, hi, thank you very much. Good evening, everyone. I feel perfect, of course. So I will try to share all updated information regarding male fertility.
Excellent. Thank you so much for joining us tonight. That's for sure. And of course, we will start with Birol's presentation on what influenced sperm quality, how it may change over time. So, of course, he has a brilliant presentation that he has prepared just for you. But after the presentation, as I've mentioned, it will be time for your questions. So don't hesitate. Go ahead. You can type the questions in the chat section during the presentation or afterwards, and I'm sure Birol will be happy to answer them for you. And let me just remind everyone that my IVF Answers, we are a part of European Fertility Society, and we are here from Monday to Friday to support you, to provide you with the best fertility advice, but also best fertility experts and embryologists and psychologists and coaches, fertility coaches. So as you know, there are plenty of topics that we have done already, as there are over 300 IVF webinars available on our site, but also there are more topics to come. So stay tuned. And now I guess I will leave it to Birol. Birol, are you ready to start
Yeah,
with your presentation?
sure.
Wonderful. Thank you so much. Go ahead.
So, okay. So when we talk about infertility, mostly we are focused on for female infertility because we have a large area and large potential to influence female infertility to use a different treatment techniques, different technologies so to achieve to get high quality of egg, to increase the number of eggs. But the same problem can be occur of male infertility. So what we can do to increase the number of sperm and quality of sperm, this is of course a big dilemma and not much more easy uh, as female infertility. So just sorry, just I will make okay.
Okay. Nice.
Yeah. First thing, like we have to know how one spermatozoid developed. Of course, spermatogenesis is the main station when sperm start to produce in male. So, and healthy male can produce about 400 million sperm every day. Of course, it depends of organism, depends of uh, social life, depends of habits. This number can be changed. So we will try to analyze how this number can be increased or decreased. And naturally, if male will produce more sperm, this will increase the chance of fertilization. So that means of more sperm, especially I am putting IVF on the side because number of spermatozoid is not that much critical than a natural conception of the IVF. When number of the spermatozoid increase with a motility and with a high quality of spermatozoid, of course, the natural conception of pregnancy will be increased. The purpose of sperm is to provide a protection and transport of the genetic material, the DNA, from the male to female egg for fertilization. It takes 64 to 74 days for sperm developing in testes. There are different factors which we will try to analyze in the next slides will affect this amount of the day and quality of the spermatozoid. So the main factor for the spermatogenesis, the function of hormones, how hormones are working and how they are affecting developing of sperm and number of spermatozoids. Of course, we have three critical hormones here. So LH, FSH, and also testosterone. So very important to regulate sperm developing. So LH is stimulating most of the Leydig cells, and this produce testosterone. So testosterone is the control regulation for the FSH and LH. So those hormone regulation is really important. And when we have, especially for the male factor, some problems, so first things, doctors or urologists or andrologists are looking for it. So when sperm count is high, that means a restrict FSH is released. And when sperm count is low, FSH release to continue. So FSH is stimulated sperm production in seminiferous tubules and it work for maturation of the Sertoli cells. And that means a sperm producing is getting irregular. So sperm channels continue to produce a sperm. Of course, that will be the different factors, especially for apoptosis as programmed cell death, can be affect a number of sperm production, while the different social factors as smoking, as alcohol can be affected to increase the programmed cell death or decrease the opposite way. And in this case, a number of spermatozoids will decrease dramatically as spermatogenesis and testosterone production will increase FSH and LH release. So basically, as a hormonal assessment, FSH should be 0.9 to 15 international unit per liter, LH 1.3 to 13 international unit per liter, prolactin mostly 2 to 15 nanograms per milliliter, and testosterone 10 to 35 nanomole in liter, and estradiol should be less than 50 picogram in milliliter. So basically, when we have a hormonal problems in a male factor, doctors get a treatment of ACG. So when they make ACG treatment, mostly they get a good result. For example, that they can increase the volume of the spermatozoid, the really better increasing from 0.3 to first ACG treatment to 0.8 and then till 2 milliliter per volume. So pH level also can reduce much better. Sperm concentration can be increased even 5 times and more than 5 times. Motility and morphology as well. Of course, let's see that treatment is not working always as properly because, as I say, the different organism can give a different reaction, while a male reproductive organs is much more complex, which we cannot get exactly effect of ACG for every organism in a cell. So when we check spermatozoid, it's basically the main part of head, which contains acrosome enzyme. This is the working for penetration of the egg cells. So midpiece contains mitochondria, which is producing ATP energy for the swimming and moving. So tail contains a flagellum, which is important for the movement. A normal sperm needs to have an oval head. So 2.5 to 3.5 micrometer of head diameter and 4 to 5.5 micrometer of the length. So when we check the classification of male infertility, there are 3 causes: pretesticular causes, testicular causes, and post-testicular causes. So male infertility disorder mostly is coming from the varicocele as up to 35%. Most of them idiopathic. So also like obstruction, testicular failure, and semen disorders can be increase the number of male infertility. When we make the classification of male infertility, there are different reasons as a chromosomal abnormalities as Klinefelter syndrome, Y chromosome microdeletion, translocation, and inversions. So genetic abnormalities as Coleman syndrome mutations and different mutations, gene involved with hypothalamus. Testicular torsion, surgical damage of the testis, recurrent urogenital infections, Exogenous factors as medication, cytotoxic drugs, heat, radiation can be big factor for the as a exogenous factors. Also, systemic disease as liver cirrhosis, renal failure, and varicocele is the big effect for the male infertility. So all of this effect decrease a dramatically number of spermatozoids, especially can be affect the morphology of the spermatozoid and natural conception of reproductive system will get a damage on male factor. So what can be the lifestyle risk factors for the infertility? Of course, there are personal factors as reproductive age. When reproductive age increase, of course, production of sperm will be dropped. Also, morphology of the spermatozoid will drop. Obesity, like exercise, physiological stress, and diet is important. Toxins like clothing, organic solvents, radiation, electromagnetic effects, temperature, alcohol, smoking as marijuana, cocaine, steroids, that different kind of toxins factors also will affect the male infertility. So when we talk about age and male infertility, of course, when age increase, lower semen volume and decrease the biochemical markers. So reduce sperm motility and the morphology with age. When age increase, sperm motility and morphology will be decreased dramatically. Increase of the sperm aneuploidies, same as we saw in a female infertility. So up to 35 years old, mostly aneuploidy risk of embryos are increasing. Same things we can see on the male factor. So after 35, 40 years old, aneuploidy of spermatozoid is increasing. That's why a sperm fish test is really important, especially which patient are going under IVF treatment. So it's a one of the basic tests after karyotyping to make a sperm fish test. Also increases sperm DNA fragmentation, which is a really key factor, especially for IVF. So every patient should have this test before to start IVF treatment, because according to DNA fragmentation result, conception of IVF totally can be changed in embryology laboratory. So also lower pregnancy rate while age is increasing, aneuploidy increasing, sperm morphology drop, and of course this directly affect the pregnancy rate. And high miscarriage rate, this is the basic factor of the aneuploidy of spermatozoid, which can increase miscarriage rate. So let's say this is a big dilemma, how smoking and alcohol can be affect on sperm quality. Of course, while depends of heavy smoker or regular smoker, effect of smoking will drop dramatically sperm quality and sperm concentration. So sperm concentration in the one side, but it can affect directly the sperm morphology. So this is a really important, especially for the natural conception, the basic effect, while most of the couple doesn't have a baby. So alcohol is the same, as you see, it's the same effect and almost more than smoking. So for the normal morphology and sperm motility and especially total sperm count as direct effect of alcohol. So what diet can affect on male infertility? So negative association as nuts, almonds, hazelnut, so meat foods. A protective association as fish, raw vegetables, potatoes, and avocado. So diet also has an important role for the infertility. So basically, many of the doctor, before to start some hormonal treatment, they try to regulate hormones with the diet. That is one of the important which almost all men should take care about: cell phones, wireless, and signal effect. Because mostly we carry up the phones like, let's say, that different kind of Bluetooth equipment. Mostly we are keeping on side pocket. So that directly, which is closer to testicular part, it can make a two effect. The first is low radiofrequency bands, which can directly affect the testicular part, especially the Leydig cell and testosterone. And second things, because of such equipment can increase the heating, so that also can make a direct effect to number of spermatozoids. The decrease in sperm parameters was dependent on the duration of daily exposure. So that's why when we carry up in our pocket, sometimes it's taking in all days. So it directly may affect the sperm count, sperm motility, normal sperm morphology, and sperm viability. So different ways to exposure of the EMF can impact the male factor as lowered sperm count, decreased testosterone level, and affected sperm DNA. So normal sperm parameters according World Health Organization, there are two different editions of the World Health Organization. So volume should be 1.5 to 2 milliliter for the normal sperm parameters. Total sperm should be around 40 million and 15 to 20 million per milliliter. Total motility shouldn't be less than 40%, and normal forms according to different criteria scoring system, 4% or 14%. One of the most important and key factors, especially for IVF treatment, to determine sperm morphology, because according to determination of the sperm morphology, spermiogram test, we can understand which technique, advanced technique especially, we need to use in laboratory and to get a better quality of embryos, which will have potential for the pregnancy. So basically, we are checking on the sperm morphology with its different morphologic color kits, like a head, cytoplasmic droplet part, and tail. So head, neck, and tail are three criteria. When we analyze, so size of head, shape of head, and also like a dimension of acrosome is really important for us. And also, if a neck is totally clear or carry up some cytoplasmic defect or cytoplasmic droplet, which directly affect quality of embryos. And of course, tail, if there is a tail abnormality, also can be effect for fertilization failure or embryo development problem. As you see in the left side, and healthy sperm, how it looks. So healthy sperm has totally good shape of head, well neck without any cytoplasmic defect, because head carry up the mitochondrial DNA, which is giving energy to developing of the sperm, maturation of the sperm, and fertilization capacity of the sperm. So same thing as a woman egg, we have same position and factor as human sperm mitochondrial DNA. Also tails, which will supply movement. So especially for the natural conception, if this three part is not fine, so fertilization failure will be the possible. Also, like non-embryo development or embryo arrest will be happen. As you see in the right side, an abnormal head looks unshaped with cytoplasmic defect, and tails also looks some anomaly. So there are different indications as low, if there is concentration a problem, mostly like a recommended test, like Y chromosome microdeletion and G band karyotype. So this is the basic every man or couple who is starting to make IVF. So karyotyping and Y chromosome microdeletion, if especially they have a low sperm count, should be obligatory. Non-obstructive and azoospermia, if happen on a male factor, especially for IVF, so epsilon, Y chromosome microdeletion and G band karyotype also should be recommended test. Azoospermia and oligospermia in the man, so especially cystic fibrosis test, gene mutation should be done, because mostly occur for azoospermia and oligospermia some kind of problem, gene mutation problem, even in normal spermatogenesis. Also, if there is a history of recurrent miscarriage of or personal or familiar history of the genetic syndromes. So G-band of karyotype is an obligatory test. There are articles which I want to share about relationship between semen parameters and spontaneous pregnancy. Here is the most important things what I want to show about smoking and alcohol usage. So when male use non-smokers, moderate or heavy smokers, as you see, non-pregnant and spontaneously pregnant has a different percentage. For example, if male is a heavy smoker, only the 4% of the pregnancy. But if male has a non-smoker, that number is going to 71%. So it's a big difference. Same with the alcohol usage. Of course, also same situation happening for female. But as you see, the percentage, male has a much more affected with alcohol and smoking. So especially when we check about the sperm progressive motility and sperm normal morphology with the non-smoker group, situation is much better than heavy smoker group. So there are big difference as a percentage for the spontaneous pregnancy with the non-smokers. Why regular semen analysis is not enough? Of course, when we make regular spermiograms, so we find out concentration, we find out motility, we find out still morphology, but that will not be enough every time. Especially like I have up to 15 years experience, and I always, when I see normozoospermia, still I have question about embryo quality and embryo developing, because if male factor didn't test it enough with the karyotyping, with Y chromosome testing, with especially sperm DNA fragmentation tested and oxidative stress testing, still there is a question about male potential. So that's why all IVF conception should be focused on sperm quality and sperm DNA quality mostly, because still we have a different kind of technologies as sperm chip, as I will show about piezoelectric activation, which can increase potential of spermatozoid when we make the fertilization, because still around the 20% of fertilization failure occur in IVF. Also around the 20% embryo arrest situation is happening. Why sperm DNA fragmentation is important? Because a replacement of histone hormones so during spermatogenesis, oxidative stress can be increased with sperm DNA fragmentation. So apoptosis is the main mechanism which can protect if apoptosis system work well. So sperm DNA fragmentation, oxidative stress, and sperm production will increase, of course. Radiation and temperature can be increased with sperm DNA fragmentation. As well, varicocele and fever will be increased for the sperm DNA fragmentation. Obesity and smoking as well, and aging. As you see in the image, normal DNA should give with the special kit of sperm DNA fragmentation as a different image than abnormal DNA. So how we separate with the sperm DNA fragmentation with the DNA color kit? Mostly when we get the normozoospermia, still 20% of the normozoospermia give low sperm DNA fragmentation, and most of the normozoospermia parameters of the sperm factors shows high sperm DNA fragmentation. That's why actually I don't believe so much like unexplained infertility, because finally when you analyze the case well, still you find either sperm DNA fragmentation very high, but it's really difficult to solve it. There are different techniques I will show in next slides, but it's still a big dilemma how we can avoid this totally on IVF. So sperm DNA fragmentation on the semen analysis, Sperm DNA fragmentation gives a better prognostic value than regular semen analysis, because a regular semen analysis can show only the amount of sperm, motility of sperm, and a morphology of sperm. But for us, it's much more important after the fertilization how DNA material will develop and match inside of egg. So during sperm transit from epididymis, oxidative stress increasing with sperm DNA fragmentation, while oxidative stress is increasing, that directly affect the sperm maturation, also directly affect the rate of embryo arrest. Sperm DNA rate, fragmentation rate increasing, we find out poor outcome and miscarriage in IVF. And sperm DNA fragmentation can be solved by oocyte repair mechanism and advanced laboratory technologies. Sometimes sperm DNA fragmentation can be really high, but still we can get high quality of embryos. So that means oocyte especially has high mitochondrial DNA potential, and that can be worked for the repair mechanism. But mostly that can be solved much more easier with this advanced laboratory technologies. So this is our work in IVMED. We can show like two different groups with the fertilization rate and blastocyst rate for the sperm DNA fragmentation. So when high DNA fragmentation, fertilization rate is 77%, but when without DNA fragmentation in the control group, as you see, 94% of the fertilization rate. So that means it is 20% of the gap is mostly getting with the fertilization failure. If we check the blastulation rate as a much difference, 27% of the blastulation rate with high DNA fragmentation, but 64% blastulation rate without DNA fragmentation and lower DNA fragmentation. Same situation we can see in oxidative stress, because sperm DNA fragmentation and oxidative stress are mostly working in parallel. 75% of fertilization rate with high oxidative stress, but a 96% fertilization rate with a lower oxidative stress. Actually, blastulation rate is similar. Why? Because oxidative stress is not always related directly with the sperm DNA fragmentation. So oxidative stress can be increased during sperm production, during sperm receiving. If like a male have a stress factor, or let's say excited situation, or also sperm preparation technique can be affect oxidative stress. So that's why a blastulation rate didn't give a significant difference. So this is the one of the advanced laboratory technologies I will show. So if you see in the left side, I will open the video. So this is a sperm chip technology. How it works? There are inlet modes. So we are just putting a number of spermatozoid, like approximately 1 milliliter of spermatozoid. So only low DNA fragmented of spermatozoid or without DNA fragmented spermatozoid can become to outlet mode. So just we can take this part of sperm which has a very low possibility to get a low sperm DNA fragmentation, and we can use for fertilization purpose. Of course, that will give a better fertilization rate and also better blastocyst outcome. In the right side, you see piezoelectric activation. This is a totally new. So after fertilization with intracytoplasmic sperm injection in IVF, so we can just give low wave of electric wave to oocyte after the fertilization to egg, so we can increase the chance of activation. While we were talking about the repair mechanism, this is the part of repair mechanism. We are just trying to give an effect to mitochondrial DNA and to increase the potential of the energy. And of course, that will give, especially will solve the fertilization failure problem and will increase the blastocyst outcome. So this is our work also about microfluidic sperm chip and piezoelectric stimulator. So when we see standard sperm selection, there are different factors for the fertilization rate, the blastocyst rate, and pregnancy rate. We get 83% of fertilization rate, 57% of blastulation rate, and 59% of pregnancy rate without sperm chip usage. With sperm chip, let's say, we get a 90% of fertilization, 68% of blastulation, and up to 70% of pregnancy rate. Almost up to 15% is difference. With sperm chip technology, we got a better outcome. If we get the conclusion, so dietary changes that promote a higher sperm count include reducing the intake of trans fatty acids and increasing vitamin D intake. Quit smoking, avoid excessive alcohol and drug use will give a better sperm concentration, motility, and morphology. Also, kind of a medication which can have a direct effect to avoid to increase sperm parameters. More antioxidants-rich foods intake can increase the sperm parameters as well. Enough folate and zinc intake can be increase the sperm parameters, especially can affect the concentration of the spermatozoid. Avoid cell phone and Wi-Fi also will be really effective to, I cannot say like you can increase the spermatozoid, but you can get a totally avoid harmful effect. And masturbation does not affect on sperm quality and number. So before to plan a pregnancy, sperm analysis are recommended as firstly, basically every male and female who will get an idea to make IVF should make a blood karyotype for sure. If there is a low sperm count, Y chromosome microdeletion test, and also sperm DNA fragmentation test or oxidative stress test should be mandatory. Low number of sperm count always need to consider cryopreservation. So this is a really very important. If you have a low count of spermatozoid, if you are going a varicocele operation, if you have idea to get a child in future, so sperm cryopreservation is a really important. Especially, I see many situation with varicocele operation. So before varicocele operation, he has a normal sperm form, but somehow after varicocele operation, probably some tubules get damaged or some mechanic damage. So his number of spermatozoid get dramatically low, morphology very low, because apoptotic part is not working, mechanism is not working perfectly after varicocele operation, and it takes so long time sometimes. So, but nobody offered them to make sperm cryopreservation before varicocele operation, and this is the most dangerous situation. So, who will have an idea to make such operation and have a low count, especially on early age after 20 years old? So, sperm cryopreservation should be the first idea. Regular semen analysis will not be enough, as I said. So karyotype, oxidative stress test, sperm DNA fragmentation test, and Y chromosome deletion as sperm fish test is recommended. Low morphology of sperm and high DNA fragmentation require advanced laboratory technologies. As a sperm chip, IMSI technology, like a morphological selected of the spermatozoid. Piezoelectric activation, calcium activation, those kind of advanced laboratory technologies always will helpful to increase outcome. Sperm morphology and sperm DNA fragmentation have a direct effect on fertilization and miscarriage rate. So that's why before to plan to IVF, so those tests should be mandatory in every IVF center. According to this test result, should be manage IVF conception. So this is, of course, a job of embryology laboratory, but all embryologists should be considered to work with high sperm DNA fragmentation with advanced laboratory technologies and to control that. So I want to say many thanks. And if you have any question, so I will be ready to give answer.
Thank you so much, Birol. Indeed, it's been a great, great presentation with lots of text, but also very nice and graphic, graphic presentation. So thanks a lot for that. Those little things sometimes does make a difference. So thanks so much for that, for sure. And well, yes, you are very right. It is time for our questions. So are you ready for them? There are a few questions left
Yeah.
here. Perfect. Let's have a look. I'm sure you have plenty of questions, lots of interesting ones. So let's go ahead with them. If there is a high DNA fragmentation present, do you recommend a vitamin cocktail to improve the fragmentation?
Okay, so DNA fragmentation is a kind of situation which you cannot solve such question with, let's say, vitamin effect. Mostly antioxidants are working well for DNA fragmentation, but still, if you have high DNA fragmentation and if you are not planning to make an IVF, of course, you need to get a long period of diet, long period of antioxidant usage. Of course, I'm not a neurologist to give you like kind of programs for that. But if you are going in IVF, so that a basic solution still in the lab inside to use some advanced technologies and to avoid sperm DNA fragmentation and to increase the chance. So we can go to next question. Mm-hmm. Yeah, this kind of treatments and this kind of way will improve the chance, of course, but it's still 77% are really high DNA damage for especially for IVF. And as I show my slides, so two things you have to do. Firstly, for sure you have to use the sperm chip technologies, and second, when you try to give sperm sample because of apoptotic mechanism. I mean, when you give the first time uh, sperm sample, will have a more DNA fragmentation than second time. So uh, my recommendation, firstly, like which clinic you are doing IVF, just ask from them to use a sperm chip to avoid also centrifugation because centrifugation also can be increase like sperm DNA damage, and also like try to leave sample which they will use for fertilization in a second sample. I mean, just he will give a sample like to wait a 1 hour, 2 hours, and to give a second sample, and to use a second sample will give a much more benefits. But 3 months of such preparation uh, actually can make effect. But as I said, the DNA damage is not like a concentration or morphology, so it's a difficult to make a change on the DNA damage. But the lab technologies, advanced lab technologies, will be increase the chance for sure.
And thank you so much, of course, Alice, for your question. And of course, Birol, thank you for answering and your advice. And let's have a look. Next question is up. So, do you think maca can help to increase the quality of sperm?
Yeah, definitely. Definitely, Manka is really a good way to try to increase the quality of sperm. But still, I mean, it is not a part of things like just you can use and you can solve everything. When you use a maca, of course, you should take care of your lifestyle. You should, if you are using alcohol or smoking, to avoid totally, to follow diet, to make exercise. In this case, of course, maca can be helpful. But I really believe from all that antioxidants and different vitamins, maca has a much more effect than others. This is just my feeling. Of course, I cannot say some kind of publication research about it, which shows like a maca have a direct effect than others, but still, it can help so much to increase the quality of sperm.
And once again, thank you so much for answering that question. Next one is TISE recommended to overcome DNA fragmentation?
Yeah, this is actually one of the way, because when we make a testicular surgery, we are just going to production center of sperm. So we just take it, especially with a micro testicular surgery, which we just take tubules, and inside of tubules we found like a first production of the sperm. Of course, a first production of sperm which is not passing through channels and coming, so has a lower DNA fragmentation. This is a kind of strategy, of course, especially if uh, a male has a low count of sperm, low concentration, low volume, yet testicular surgery can be effective. And but before that, at least you should have a 2 IVF trial with a regular sperm. If there is a no result, still if there is a fertilization failure or embryo development problem, then testicular surgery should be an advantage for to avoid a DNA fragmentation.
All right, again, thank you so much for your question and your explanation to that question. And of course, let's have a look. Okay, next question is, so any chance to improve sperm quality in old men over 60?
Uh, yeah, of course, when reproductive age will increase, as I said, the sperm quality and concentration will be decreased. But still, of course, I have, according to my experience, I saw even men over 60, somebody has a really normospermia. Somebody have a low count, but with a good lifestyle, they can increase. But it's difficult to give answer to such question. That mostly is, let's say, lifestyle related. So, well, if he has a normal lifestyle without any smoking, without different kind of health problems, let's say, uh, if he avoid to use any kind of a medication, because after 60 years old to use kind of antioxidant therapies, vitamin therapies and such things to increase the sperm quality is not a perfect idea, let's say, because it can make affect a different affect a different part of body. That the only point to get regular lifestyle with a more exercise, let's say, to walk, to get moral life, let's say, without smoking, without alcohol, there is of course a chance to improve sperm quality. But it's not easy as like between a 40 to 50 years old. So up to 50, of course, mainly like unemployed rate of sperm will increase dramatically. When we say sperm quality, we cannot say only about the morphology of sperm, how it looks, sperm with head morphology, with tail, or with a neck morphology, but still DNA capacity is really important, and with reproductive age will increase, of course, unemployed rate will increase, while apoptotic programmed cell mechanism will be dropped so much.
All right, again, thank you so much for answering that question and providing some details on that as well. Okay, next question is up. So, do you recommend Zymode's preparation?
Yeah, definitely. It's a kind of like which I explained, similar like microfluidic sperm chip technology. It's a similar, and Zymote is working here perfectly. Of course, that will be actually priority, even not if there is a like a problem on the sperm count, sperm morphology. Actually, it should be routine. So most of the countries, most of the clinic, it start to become to use them as a routine. So they don't make any more centrifuge. They don't prepare sperm with a different way. That just they use a zymote, or they use a microfluidic sperm chip, and they prepare sperm for intracytoplasmic fertilization. So it's a good way to use, of course.
All right. Again, thank you so much for the explanation. And there are like 2 questions left. Okay. So if you have any left, you know what to do. Go ahead and type those in. And let's have a look. It's a bit of another question, which is you mentioned nuts as negative association, but here in Nigeria, pilot studies seem to favor the use of tiger nuts and date nuts in the boosting of semen parameters. How do you explain that?
Yeah, actually, of course, there are always some articles and articles. So, what is the point of nuts and nuts dates? Like why I said it can have a negative association, because it's part of related with the cholesterol and part of related with the hormonal effects. So as I said, FSH and LH should have a balance. Of course, again, I'm saying, and finally, I am not a urologist to give or andrologist to give a direct answer to your question, but we should keep in a balance these hormones. So there are studies, it shows such kind of diets, like nuts diets especially, can be affected directly like a pressed of FSH regulation. So while if FSH regulation pressed, always testosterone regulation is affected as well. So my explanation should be directly about the hormonal stage. So that's why it can make affect a bad way. But as I said, of course, all of us in regular life we are using such kind of product. But when we try to use for that to increase the sperm parameters, and as I see the diet, so people are eating like almost all day such things, and they are planning to increase the sperm parameters. But when they did that, of course, they are giving a damage of the regulation of hormones. That is the point why it can be negative association. Of course, the regular usage of any kind of vitamins, antioxidants, nuts, like will not give a direct effect. But when you use that as a diet purpose with high amount, so it will directly affect the regulation of hormones.
And again, thank you so much for definitely an interesting question and your answer to
Yeah.
that. Okay, let's have a look. More questions are coming up. Okay, what can one do when one has bought all the known antioxidants, example, maca, ubiquinol, etc., but every week your beloved husband needs 30 minutes of cajoling the use to use his cajoling to use his supplements?
Oh, yeah. I see. I mean, um, you know, of course, like this kind of antioxidants and supplements, I have experienced many patients are using that. If you ask, if you see the direct effect on all of them, actually not. So when it comes spermatozoid, to especially to embryology lab, while I am an embryologist, in the lab, for us, there is no difference between 100 million spermatozoid or 1 million spermatozoid. Finally, for us, okay, we need a sperm like a same amount of egg. If we have 15 eggs, so we need only 15 spermatozoid. And believe me, it's so easy to find out inside of 1 million or 100 million is the same for us to find high quality of spermatozoid. If you have a such problems, especially for a low concentration and low, let's say, motility or morphology, so my suggestion, of course, just to don't lose time, because of such kind of treatment cannot change the profile in a 1 month, 2 month, or 3 month. You should use a maybe years, minimum 6 months to get the direct effect. But this effect will not be like a dramatically increasing. So if you have a 1 million of concentration, and if you are thinking after such treatment, you will get the 15, 20 million, actually, that will be difficult. So that's why for the natural concept, the most important things, if you have about the 20 million of the concentration, but still if you don't have a pregnancy, So mostly, you should get a consultation with your like a gynecologist to try to manage actually the ovulation time and implantation window will be much more effective than spend your time, especially reproductive age is really important, with such kind of supplements because they will give effect a really long period.
Thank you indeed for indeed excellent question, and we've received that many times as well, of course. So, and thank you so much for your wonderful advice here. Okay, let's have a look. We have the
Yeah.
next question from the very same patient. So, do you have experience using glutathione to improve sperm DNA?
Uh, Actually, I don't have experience, but I read some articles about this. Actually, there is no significant difference according to articles which I read. Improve the sperm DNA. Uh, if you ask that like a direct what you can use to improve a sperm DNA, because glutathione also kind of antioxidant, and it can improve, of course, sperm DNA. Any antioxidant can improve sperm DNA problems because it's directly connected with the oxidative stress. So it can decrease the oxidative stress. When oxidative stress of decrease, of course, a sperm DNA fragmentation will get much better. So for sure there are direct effect, but I cannot say like I have experience. But according to publication, effect is not so significant.
And again, thank you so much for that. And actually, let me go to the follow-up question, okay?
Yeah,
I understand the mustard oxidant glutathione is hardly
yeah.
absorbed orally, so it's advised to use. I'm not sure. So here, do you have any experience of this antioxidant?
Actually, I cannot, of course, give answer for this question while I say it. I'm an embryologist, so it's difficult for me. But like I can get this question to our andrologists, and I can try to, if patient contact, so I can try to give them
Hmm.
exact answer which way will be better for them.
Yes, understandable, of course. Thank you so much indeed, and I will definitely try to get it to you, of course. Okay, we have a follow-up, so it's I have a push intravenous. Sorry, I will just
Yeah, next
show you.
question. Uh-huh.
Does it help? Intravenous.
Yeah, yeah, this is I mean, a part of last question, as I
Yeah.
said. So I will
Mhm.
try to get answer about that.
No problem at all, of course. I
Yeah.
understand completely. We can still forward this, and I'm sure it's possible for us to just simply um, get back to you on that. Thank you so much indeed.
You're
And let's
welcome.
have a look at the next question. So, what are your thoughts on IMSI procedure to select better semen?
Yeah, IMSI procedure is fine. Of course, when you use the IMSI procedure, you should support IMSI procedure with another. As I said, if you are using first uh, microfluidic sperm chip technology, or let's say Zymo technology to firstly to eliminate the DNA fragmentation, and then you can use IMSI technology to choose high morphologic quality of spermatozoid, because with IMSI technology you can still see especially head part. You can avoid, I mean, regular 40 zoom of the objective, still you are not able to see like organelle parts as a vacuola or some defect. But with 600 times of magnification, you will be able to avoid such sperm, which also direct will affect, because of vacuola can absorb the energy from sperm, and it can decrease the potential of fertilization. So that's why IMSI is important. Yeah, they can use. But as I said, firstly we have to avoid like a risk of DNA side, and then to use advanced technology as IMSI to choose high quality of spermatozoid.
And again, thank you so much indeed for that explanation to this question. And now let's have a look at another question. So, do you think that benign prostatic hyperplasia has any negative effect on sperm quality?
Yeah, definitely. How it can affect them negatively? Uh, it is related again about apoptotic mechanism. So because such kind of effect is a directly will give a kind of traumatic effect to testicular part. So apoptotic cells, how it's work. So when sperm production is continue, if there is some effect as a like prostatic hyperplasia, sperm production is getting much more slower. So sperm is moving in the channel, but half of the channel, because of acidic part, sperm start to die. So sperm can make some barrier on the channel. New production of sperm is just coming, but just stucking at this barrier. So part of sperm is still passing from the barrier, but part of them is coming, staying there. So which sperm is passing barrier? Firstly, number of concentration drop. Second, of course, some quality of sperm stuck the barrier. Maybe low quality of sperm is just passing from the barrier. So that is the main effect, how it can be negative on the effect of sperm quality.
Thanks so much for yet another definitely interesting question. And at least for now, it's no, sorry, there's another question,
Mhm.
but of course, if you have any left, okay, we will be slowly finishing. So go ahead. This will be like the final call for your questions. Go ahead and type those in. The question is, so what do you think of combining max selection and IMSI to choose the best sperm for IVF?
Actually, of course, that will be the perfect combination to get better quality of sperm. As my experience, when you support IMSI with a different technologies as MAX, like also as like magnetic selection, let's say maturation, high quality maturation of the sperm selection, microfluidic sperm selection, also zymote sperm selection, together with IMSI give much better outcome. It's almost like even in very difficult cases, I see very high blastocyst rate. Because when we say about blastocyst rate, is still there are important what kind of blastocyst we receive from low sperm count and low morphology, high sperm DNA fragmentation. Also, of course, especially if you have a low sperm quality, high sperm DNA fragmentation, and high reproductive age, doesn't matter which reproductive age female has. For sure, you have to test that your embryo with NGS technology. So you get a total genetic profile of your embryos, while those kind of problems can be increased unemployed risk. So that can be different kind of genetic abnormalities and gene mutation. So that's why NGS will be really important before to make an embryo transfer on IVF.
And once again, thank you so much indeed for yet another explanation. Let me have a look. Okay. Okay, this is a comment, but I just want you to thanks so much for your answer. I'm very relieved we have chosen the best combination of lab techniques. Okay,
Yeah.
that's here. Thank you so much. Well, at least at this point, I do not see any more questions. But of course, if you have any questions left, go ahead and do it now. And if not, remember you can. Yes, we have another one, I guess. But of course, I just want to mention that if you have any other questions, remember that you can get in touch with Birol and his team at IVMED, and I'm sure they will be more than happy to help you out with some other questions. And before we finish, I guess we can still answer. There's another question, a bit of a longer one. Bureau, let's have a look. Another fantastic presentation. Just wanted to say a huge thank you for your incredible help. After 12 IVF cycles at all the clinics and countries, we never managed to get our long awaited family. We are now pregnant with surrogate and your incredible expertise. You would never have been at the stage where we are now awaiting birth of babies. I just wish we knew about you earlier and not have wasted so much time. The best embryologist. Thank you so much. What can I say to that, really?
Thank you, Angela. Nice to see you here.
Thank you so much, Angela. And of course, congrats. I know that it's been a long way
Yeah.
uh, ahead. I mean, that was an incredible journey you had, and I'm happy to see there are some happy news here as well. Thank you so much indeed for sharing this comment. And yeah, as you can see, Birol, one more comment. So huge
Yeah.
thank you for that. And I guess we will be finishing, okay? And before we finish, Birol, anything you would like to add?
Yeah, of course, I am always open for any question, any support. Anytime they can call, they can write. So actually, like uh, that, some patients are here familiar. I know them, and they know me. So I am always open to question, and I do my support. As finally, I'm an embryologist, and I understand them much better. I know how to talk of language of the biological material, let's say from the sperm and egg side. I know how difficulties they have. I know very well how much time they are spending, how much energy and also money they are spending. So that's why anytime just they can write, they can ask, and even if they are not our patient, doesn't matter. I will try my best to help them and to give them answer for their question.
Wonderful, and really thank you so much for that. Of course, your additional words. And as someone asked, if you can share the details to the clinic, I have just sent you a link. There is an option to get in touch with Birol and his team, and it will be forwarded straight to them. You can simply go ahead and use that, and I'm sure. As I've mentioned, as you know, as you've seen, patients are already familiar with Birol and his team, so you can be sure they can help you out. And well, there are more thank yous for you. So thank you for your incredible questions. As always, you never disappoint with the questions. They're always brilliant. So thanks so much for that. Birol, once again, thanks for a wonderful presentation. Those are topics that I definitely am happy that we are able to bring to you every single day. And it's been a great session. So thank you so much. Everyone, I want to mention that this has been recorded. So as you know, it will be available on my IVF Answers tomorrow and also on our YouTube channel. So subscribe. That way you will be notified when the video is uploaded. And well, as you know, we will be back here tomorrow at 8 p.m. UK time. I do hope to see you there. And I'm sure you have more and more questions to ask. So huge thanks. Everyone has a have a lovely evening. And Birol, once again, it's been a pleasure. And before we end, I want to add that Birol will be back on Friday, actually.
Yes,
So there is another topic we will discuss azoospermia. So if you haven't asked your question, you can also do it on Friday. Okay. Thank you so much, Birol. See
thank you
you
very
on
much.
Friday.
Have a nice evening.
Thank you. Bye.
Bye bye.